More now on what's happening in Florida. The state has become a new epicenter for the virus, Florida, as CDC data shows that new case numbers there make up nearly a fifth of all new U.S. cases. Let's bring in the president and the CEO of Jackson Health System in Miami-Dade, Carlos Magoya. And, sir, I'll start by asking how many cases, how many patients you have in the Jackson healthcare system compared to, say, 2 weeks ago? And how bad is the situation in Florida overall? Why is it this bad?
Well, we are at Jackson, we are 230 patients relative to where we were 4 weeks ago. We were at 50 patients. So we almost fivefold the number that we were. The only good news is we're still 45% from the peak from last year. Miami-Dade County is the most vaccinated county in all the state of Florida, with 78% of our population vaccinated. There's still about 350 to 400,000 people unvaccinated. At 230, by the way, all but 7 are unvaccinated. And the 7 patients that are vaccinated are transplant patients that are immunocompromised. So if you take those out, really, we're 100% unvaccinated. The difference between this year and last year for Florida, just quickly, is that last year it was a South Florida surge. Dade, Broward, and Palm Beach had the issues while the rest of the state was not that much. Now what's happening, the rest of the state, parts of North Florida are running 150, 200% of the numbers from last year. That's why the numbers are so large in the entire state. Definitely a correlation between high hospitalization and low vaccination rates in the individual counties.
So if you take out the people you say with underlying conditions, the unvaccinated make up 100% of the people that's in your hospital right now. Can you help us out? Because we've been reading everyday headlines. Florida makes up 20% of the COVID cases in America. Around those numbers, that still seems to be the case. Do you know why? Have you heard any good operating theories on why the situation in Florida is so bad right now?
Yes, it's what I said before. I mean, if you look at places like Jacksonville, Duval County, and Clay County, they still are 43 and 48% vaccinated. They're suffering tremendously. And all the rural counties up in the northern part of the state that have less than 50% vaccination, they're having the highest amount of infection rate and much, much higher than last summer. Down in South Florida, we're seeing a little milder, although the numbers are huge for us. They're not as big as they were last summer because we have a much higher vaccination rate.
So, Mr. Magoya, there's been talk about whether or not there should be mask mandates in Florida. That conversation is happening in cities and states across the country. Governor DeSantis in your state saying he's not going to mandate masks inside of schools. What's your view about kids in schools? Should they have to wear masks this fall?
Well, obviously, look, we've been at the masking for 18 months, and there are an awful lot of people that are aggressively against masking. Yes, masking does help. And obviously, it's important to be able to wear masking wherever possible. But the number one answer that we're trying to focus on in a single message is about vaccination. Hopefully, we'll have a vaccine here soon for kids under 12. And I hope when that happens that we will vaccinate as many kids as possible. And again, even though we're at 78%, we need to get that number even higher than that to be able to continue to reduce that. We're 90% Delta. We're finding new variants down here that are coming from other parts of the world. And the infection rates are very high. The only answer is vaccination.
All right. President and CEO of Jackson Health System in Miami-Dade, Carlos Magoya, thank you so much for being with us.